Well, I think the first thing is that each person will have their own expectations, because some people have pains in an intimate relationship. Other people have difficulty getting along with people at work. Some other people may have physical symptoms that they're troubled with and don't know how to deal with. And on it goes. Or some people feel lonely because they can't make relationships. So each person has their own goal about what they're wanting to accomplish. And there are different therapies that are more helpful for different outcomes for different problem areas. And so that's one reason I've liked studying for most of the American forms of psychotherapy, because I find that different therapeutic approaches are helpful for different kind of problems and problem areas. But we all had our problems, our programming that started back in those first 5 years of life. They say we form our personalities by then, but we don't remember much about it. And so if I'm lonely, if I'm depressed, or if I'm anxious, if everything is negative communication, most of it got programmed in way back. And so then the therapy has to adapt to that and work with that part, so the person can begin to feel more confident about their own skills to get past those disturbances. And the therapist would be, the whole approach is to help them develop that, to get rid of the things that hold them back from accomplishing what they're wanting to be and do and feel in their lives. And not to expect that just one therapy fits everything. Well, what's important in the first session of therapy is for a person to see if the therapist can really understand what the problem is that the person is bringing. And if they've had the experience of the training and systems that can help out with that problem. And it's effective in doing so, because different therapists affect different problem areas in different ways. And so I think the first session is really to see if there's an emotional connection. Do they feel like the therapist really hears them and can understand what they're dealing with? And then for the therapist to see, do I know the tools that can help with that problem area? That can really help in dealing with relationship issues, or with health issues, or stress issues, and so on, as it may go in a person's life. Well, the most important thing in the early part of the relationship is how the two people connect. Do they feel like the therapist really hears them, can understand their problems, understand their feelings, and has compassion for them where they are, and has some knowledge about how to help deal with it, and so on. And so I think it's important that that gets communicated in the early session, that if the therapist can be of help to that, maybe to help the person see what the kind of work would be that they do together that could help work that out. And if that's missing, and they feel like the therapist doesn't really hear them, understand them, that's probably not going to be a good match for them. Well, they want to feel like the therapist is knowledgeable, has a skill and knows what to do, is somebody that can listen to them, can hear them, and hear their feelings, and hear what it is, the pain that they're bringing. And hopefully they've had some experience in dealing with that and can communicate that in a clear way, that they can be of help in working out those problems, whatever they might be. And so I think most people want to know if the first session or 2 or 3, is this person I can feel good about continuing to talk with about it, and to have the tools that can help me. Well, a good match would be if you can feel like that the therapist is one who really hears you and has compassion for you and understands your problem area and has experience in dealing with it. And experience can help successfully and to be able to work out that problem area. And that's really important to determine that in the first meeting or 2 or 3 with a therapist. Is this a good match that's going to work for me? Certainly, if you'd like to learn more about these methods or these tools or the combinations of them and how they work, I'll be glad to talk with you about it. You could contact me by phone or by email, or you could call me and we could make an appointment or 2, and we could discuss it more in relation to your area, your issues, your problem areas, and what would be effective for you to do together. So I'd be happy to explore those things with you. I have people who want to come in person can see me in New York City or in Westport, Connecticut. Others may prefer to have session by Zoom or telephone or FaceTime or things like that. So that's possible too, especially during this coronavirus situation. So whatever works for you is I'm open to explore with you. And I'd be glad to answer any questions you might have about what this therapy is like.